Ready? Perfect. So, welcome everyone to Open Lab and to the presentation of our design project, Greenology Care. This is a project founded on a challenge given by Södersjukhuset. But before we explain our final concept, we thought maybe introducing the team would be prudent.
I'm going to start. My name is Victoria. I'm studying user experience design at Södertörn University.
I'm Clara. I'm studying global studies at Lund University. And Miriam couldn't be here today. I am not her, but she did study architecture and urban planning.
And I'm Usaima, and I'm studying user experience at Södertörn.
My name is Hjalmar. I study landscape architecture.
And my name is Iman, and I have a background in international relations and human geography at the Stockholm University.
My name is Carl Peter. I have a background in international relations in University College Cork and political science at Stockholm University. And just to quickly say, this is then the team that have now passed for the past several months worked on this design project. But first, you have seen this name, Greenology Care, now for the second time. But what is it? Well, it is our final concept, but to be able to properly tell you about it, we must first tell you a story. Here you can see the outline of the presentation, and then we will first start by introducing the original challenge.
So when we first met our challenge giver, they give us the national challenge, which they represent their challenge and the difficulty that we're facing now. And it was how can we ensure that our patient feels safe and prepared before their examination, and how might we ensure that our patient feel prepared and physically and mentally before and during the examination, reducing anxiety and improve the patient experience before and during the examination. So we start doing our observation interview and survey with both patients and nurses. And based on the insights, we create our functional personas and their customer journey map to see their experience and emotional and needs during each touch point. So based on our insight, we identify the needs for reframing our challenge, and which was information to give the information to the patient before and during the examination, and create more convenience and comfortable waiting rooms.
Yes, so after identifying the needs, it was necessary to redefine our initial challenge. So it was updated and focused on what we thought was the real challenge. Therefore, we redefined the challenge, focusing on the three categories of needs that Osama just said, and incorporating a perspective on the nurses, since their situation is a big part of the radiology department. The redefined challenge became, how might we create a comforting environment which prepares patients for the exam by providing them information, making the experience convenient for both them and the nurses. Out of the redefined challenge, we developed 5 different concepts that was presented during the midterm here at Open Lab for our challenge givers, which we will shortly explain now. And the first concept, Blip Band, is building on the current infrastructure, using the wristbands here, the identification bands that hospitalized patients already use at SAS. The wristbands would be developed to include specific information about what exam the patient was having and the correct waiting room. So the idea is to blip your band and you can get an introduction video with the nurses working, or be shown the way to the right waiting room or information about your exam.
Our second concept is called interactive AR artwork, and it's based on augmented reality technology that will provide information for the patients in their physical environment. Since this is part of our final concept, we will go more in depth later.
Yeah, the next concept is called House of Healing, and this concept is about adapting the hospital environment to make it more approachable. And we aim to do so through the inclusion of more greenery, visual breathing exercises, more comfortable furniture, and sound healing.
Yes, and we also identified a number of recurring practical questions that we wanted to, from the patients, that we also wanted to address by developing a solution providing personalized information based on the patient's particular exam. So doing that, we also wanted to explore the advantages of providing directed information in more private environment rather than, or in contrast to the more general information in public areas.
Yes, and then the last concept is called Path Buddy. And the entire system was built that when a person would approach the radiology department's reception, they would interact with the screen. The screen would then activate lights in the that would indicate where the patients were supposed to go, and they were color coordinated. And the fun twist with Path Buddy was that when you started walking on these color light coordinated walking ways, then there was these feet that would walk next to you, so you wouldn't walk alone. And if you were a child, you could get animal feet that could walk next to you.
And we got some feedback both from the challenge givers and from the nurses working at the radiology department. That was from feedback from a presentation and from answers from the survey that we gave them, and our internal evaluation as well, where we use design thinking methods and discussions. And we created a pros and cons table, and here are the key factors from the feedback and pros and cons table that we had to take in consideration when developing the final concept. And they are that, like, informed patients would make the examinations run smoother for both nurses and patients, that the concept needs to be accessible for patients in beds, hygiene criteria for the radiology department need to be achieved, and that reducing anxiety is a key factor for examinations to be more convenient. It would be good with both something digital and analog, and to satisfy different kinds of patients, and that feasibility of the concept is key.
Yeah, so taking this feedback into consideration, it sort of led us to the AR interactive artwork concept. And we felt like this concept satisfied the need for information quite well. But that said, when you look at the need for comfort, it doesn't necessarily address this. And what's more, so from there, we realized we need to integrate aspects of our House of Healing concept into our final concept so that we can satisfy both these needs. We foresaw that together these needs can, in combination, they'll satisfy the need for convenience, making the examinations more convenient for both patients and for nurses.
Yes, so taken all together, our work and results are manifested in our final concept that we call Greenology Care. And the name is a wordplay with the words green and radiology, but also green and technology, as they reflect our desire to incorporate greenery and technology into the radiology department. We ultimately also felt that the caring touch was very essential to this challenge, so that's why we ended up with this name. Our concept is based on three main themes that, when put together, create a coherent whole that also answers up to the needs that we identified. And the themes, as you can see, are greenery, art in augmented reality, and visual breathing exercises. So starting off with the AR artwork, we visualize the use of this feature to be in both the waiting rooms and in the summons sent out to the patients before their visits. So when sending the letters, we suggest the AR artwork to be implemented by including a QR code that directs the patient to personalized illustrations and information regarding their specific exam. The implementation of the AR artwork at the waiting rooms could be placed by using a third-party AR software that can help to turn the art into lifelike illustrations alongside interesting and relevant information for the patient. And we will later also show you how this procedure will look like from the user perspective. So secondly, we have secondly, we have these breathing exercises that we suggest to be implemented in form of light installations, ideally by using this Mido lights by Studio Drift. And since they are hanging from the ceiling, they could also be accessible for patients lying in beds. And they are more visually attractive than screens, so they could be accessible for everyone. As you can see, they are also in the shape of blossoming flowers, which fits well in with the greenery theme. So alongside these elements, we see that investing in greenery also will add an important value in terms of improving the sense of tranquility and calm in the waiting rooms. Yes. So why Greenology Care? The combination of elements within our suggested concept carries good potential to improve the customer experience and help to reduce anxiety and stress among patients, while also improving the experienced attractiveness of the radiology department for both patients and staff. The estimated benefits from this concept are based on research findings, stating how elements from nature have the potential to reduce stress and positively impact patients' perceived waiting time and behavior. A lot of research has also been made on the matter of art and its influence on humans, commonly stating how it can improve people's well-being by increasing positive feelings and tendencies for socialization. The particular use of the AR technology in waiting rooms has also been shown to increase engagement among patients and to provide positive escapes or distractions. Well, it also can help to create a modern impression that carries the potential to lift up the experienced trust towards the care agency.
After choosing our final concept, we started sketching out and prototyping our idea. Using the prototyping tool Figma, we came up with an interactive and clickable prototype. So when the patient first arrives at the hospital, they will register in the entrance area and will then be guided to the waiting room, where they will see the artwork on the wall, as well as an introduction on how to use it, and the QR code you can see here. After scanning the QR code, they will then be led to a website welcoming to the waiting room. The next screen is going to be a little onboarding, as well as they need to accept the access to their smartphone camera in order to scan the artwork. Since this is just a prototype, we weren't able to integrate the AR feature, of course. So here now we need to choose, but in real life, you would just scan the artwork. After scanning the artwork, you first see the machine, because we identified that a lot of people don't even know what to expect when they go into the exam. And then we have different options. So you can either educate yourself and find out more about what, for example, an X-ray is, learn more about the machine, or watch a little video on how the exam is gonna look like. Because we also want not just to inform, but also distract. You also have the option to learn more about the history, for example, or some fun facts about exams. Since the hospital is already using color-coordinated waiting rooms, the user interface will also change accordingly to the waiting room colors. For example, the green one and the CT one would be the blue one. We then went on and tested this prototype at the hospital.
Yes, so the two parts of the concept then that were of Greenology Care, which were tested among nurses and patients at the radiology department, were a prototype of the interactive art AR artwork, which you have seen a bit, and the breathing exercise with the animated lamps. With testing, we got interesting feedback. New patients then wanted to simply know more about what the results say. There was a wish for more transparency on the procedure and an openness to using one smartphone. Nurses at the hospital found it to be a great idea because according to them, waiting rooms are boring. The testing also brought in interesting feedback about who the interactive art was for. The interactive art revealed itself to be a great tool for improving the waiting room experience for walk-in patients, i.e. active ones. It was also commented how it would be great for children considering its interactive design. And then for breathing exercises, regarding the breathing exercises, patients and nurses found it interesting. According to patients, to have something that took your mind off of sitting in a waiting room at a hospital was something that was very nice. And they really liked the visuals. And then how we then tested that was that we would show them videos of how this breathing exercise lamps would work. And then different patients mentioned how anything would be better than it is now.
Yeah, and I mean, speaking of constructive feedback, when we tested our prototype, we also got some constructive feedback, namely that our AR interactive approach is indeed catered to those who are healthier and more mobile, as well as those who are more technologically savvy, like younger people, for instance. That said, in our early findings, when we spoke with nurses initially, they told us that the patients who feel most anxious and have the most questions tend to be the healthier patients and tend to be the younger patients. Therefore, our approach might be less accessible to these people, but it tailors to the people who need it the most. Additionally, it's future thinking. I mean, we would hope that people in the future would be more have more technological efficacy, and therefore we see it as a really long-term and forward-thinking solution. Yeah, and finally, I mean, this is Greenology Care. It's really a representation of all of the work that we've done and observations and people that we've spoken to, but also, you know, it's from our ideas, but also the ideas of all the nurses and the patients we spoke to at SUS and our classmates. So for these reasons, we really think it represents our redefined challenge. It serves to address these needs, but more importantly, in the future, it can be scaled up to encapsulate more stressful situations, like the airport. Before we were having this presentation, we joked that those visual breathing lights we could really use them at that moment. Yeah. That said, even though it can be scaled up, we do really urge the hospital to take into consideration using it in this specific environment because of the way it's trying to undo negative attachments and make a hospital a more approachable and more pleasant place to be in, one that we look forward to going to, maybe. You know? So yeah, I mean, it's a solution to a problem that isn't going to go away if we don't do anything about it, but also one that is avoidable. And therefore, we really see it as an important intervention in this challenge. Thank you.